Hi, I'm Jan Navin, and I'm happy to welcome you back to the Helen Bader Foundation CBRF Caregiver Training Program. This unit will be on personal cares in the CBRF. This unit will be presented by Sally Christensen and by me. We are both nursing instructors at Waukesha County Technical College in Pewaukee, Wisconsin. We will also be showing you segments of the training tapes by Virginia Romaine from the Lakeshore Technical College in Cleveland, Wisconsin. We will start the personal cares unit with the pretest. Complete the pretest, and then your answers will not be reviewed until you have completed the post-test at the end of the unit. Remember now that your answers to the pretest and the post-test will not be graded. Please turn off the video now and complete the pretest in your workbook. Welcome back. Let's talk about the regulations for the CBRFs and what they have to say about personal cares. In the definition segment, personal cares are defined as activities of daily living. We often call them ADLs. The definition of activities of daily living means self-care and includes several activities or tasks. These tasks are bathing, grooming, dressing, toileting, eating, manipulating objects, ambulation, rest, and leisure activities. During the course of this unit, we will be covering bathing, personal hygiene, grooming, dressing, toileting, eating, manipulating objects, ambulation, and rest. The leisure activities will be covered in the activities in the CBRF unit. Each personal care that we discuss will be divided into 4 segments. Number 1, the reason for the personal care. Number 2, the general guidelines for the personal care. Number 3, supplies needed for the personal care. And number 4, the procedure for the personal care. Sally and I are going to begin by talking about some of the general guidelines for personal cares.
So let's start with the first personal care guideline. Remember that personal cares are very personal. You need to give your resident the respect and the privacy that they deserve. Many of your residents may have never completely undressed in front of another person before, and a resident may become very resistant to these personal cares. And remember, a generation ago, these people may have never undressed in front of anyone as we do today. Put yourself in the resident's place. How would you feel if a stranger were going to bathe you and to wash your private areas?
Safety always comes first when we're working with a resident and his personal cares. Safety for the resident and yourself should be your first consideration. This means use your good common sense and appropriate body mechanics. Maintain a safe environment. This means, quite familiarly to us, no water on the floor, a safe place for a resident to sit, but it also means that you have to have taken care of or have in a safe place the other residents for whom you're responsible, so that your time is free to do the activity for the resident that you're working with in his personal cares. Follow standard precaution guidelines and never perform an activity that you do not understand or have not been trained to do.
Next, you need to be prepared. You need to have all your supplies ready before starting a personal care. And if it would help you to make out a list so you can gather those supplies and not forget something, then go ahead and do that.
Try to focus on familiar skills or tasks with the resident. Residents with dementia will gradually lose their ability to learn new tasks. So we have to help each resident maintain his level of functioning by allowing them to do as much as they are able to do.
Be sure to give the resident a choice anytime that you can. Choices could include, would you like your bath now, or would you like it in 20 minutes? Or would you like your bath now, or would you like it after dinner? Also, when they're getting dressed, give them a choice of 2 different, say, shirts to put on, or pairs of slacks, and let them choose between the 2 of them as opposed to saying, here's your closet full of clothes and there might be 15 shirts. That would be very difficult for them to do. But do include them in choices so that they feel they have some control over things that are done to them.
Allow plenty of time for information to be absorbed or understood by the resident. Residents with dementia will need more time to absorb and understand simple instructions or sentences. Allow a moment of silence before gently repeating the same instruction or sentence. This requires a lot of patience on the part of the caregiver. Be careful that you don't boss them or become too assertive with them. Dementia clients will respond to your manner just like any other person would. Dementia doesn't remove the need to be treated courteously and warmly.
Next, remember to repeat your instructions exactly the same way. It may take repeating several times until the resident understands and responds. You need to be careful to be patient with these people and to not rush them through. And you need to be careful that both your words don't make them feel rushed and also your body language, that you give them plenty of time. You may need to use different keywords when you are working with these people. And if you're asking them to sit down and repeating to ask them to sit down, you may want to rephrase that so that your patient understands what you're doing.
Sally, your patience is very important. As you stated, I remember a resident who I was caring for, and I suppose I was getting a little bossy with her, and she said to me, "I've lost my memory. I haven't lost my mind." In other words, she was telling me I am to be treated as an adult and as an important person, and give me some time. Break the task down into simple steps. The task of getting dressed or taking a bath may be too complicated and overwhelming for the resident with dementia. The resident with dementia may respond better to small, simple steps within the task. An example of this, when you're dressing a resident, might be unbutton your pajamas, take the right arm out of your sleeve, etc. Find out what steps the resident can do by themselves and encourage those. Doing tasks together can be much more successful and pleasant. One of the experiences that I remember is having a resident who wanted to button his own shirt, and I thought it was going to take too much time for him to do that. So he buttoned the top buttons and I buttoned from the bottom up so that we both did what we felt we needed to do and cut the time down.
And you may need to change the steps as the resident's dementia becomes worse. As it progresses, you may need to break down these steps into even smaller steps, and you may need to gently begin to take over some of the more difficult steps and let the patient or the resident continue to do the easier steps. Remember, if you take the time in your patient, that this can be very rewarding for both the resident and for you, the caregiver.
The residents also need to be praised sincerely for success. That praise needs to be honest. Residents will perceive a false praise or a gushy, overdone praise. We all need to hear that we're doing a good job, and it is especially important for the resident with dementia. Sometimes a simple, "you did a good job," or a "thank you for helping" is sufficient.
We also need to observe, report, and document the things that you see, hear, feel, and smell. What changes do you see as you care for the resident's body? What do you hear the resident say about what they're feeling? Do you feel any lumps, any bumps, or any rough areas on the patient's body? And do you smell any odors coming from the resident? Be alert to any physical or mental changes in the resident, and be alert to any changes in the resident's habits or in their behavior. You need to document only facts, not your opinions, not your feelings, and not your conclusions. Now that we've discussed some of the general guidelines of personal cares, Ginny will review some of the basics regarding personal cares. Then she will start us off with the first personal care, which is bathing. You will see Ginny in a variety of settings in these nursing assistant videos. Some will be in a hospital, some will be in a classroom. And Ginny will usually refer to residents as clients or patients. Some of the written materials in your workbook will not be covered on the videos, so you will need to read the workbook in its entirety before taking the post-test. There is a lot of important information on these videos that you don't want to miss, so remember to follow along in your workbook and take notes as you need to.
Sally and I will be back from time to time between the segments of the training program by Virginia Romaine that you will be watching. At that time, we'll reinforce some of the items that we have learned about personal cares.
Nursing assistants will, within any number of hours of a day, be involved with the personal care skills of our clients and residents that are entrusted to our care. Now, when we talk about personal care skills, we're really just talking about hygiene, personal hygiene, the things that we do for ourselves daily and probably think very little about it. But imagine yourself if you're now disabled or ill and unable to take a bath or wash your hair or perhaps clean and trim your fingernails or toenails. What if you were to need help dressing? There are so many things that we do routinely that now we must consider as part of the personal care for our patients. When do we do these skills by and large? Well, think about it. When do you normally do your personal hygiene? I have a feeling that most of us probably when we get up in the morning, or if you work nights and you get up from a fairly long period of sleep, very likely take a bath or at least wash up, very likely do oral hygiene, brush our teeth perhaps, very likely we comb our hair and occasionally of course wash it. If you're a man, very likely you're going to shave on a routine in the morning or when you get up. Certainly you're going to shave when you go out for some type of a social event. So when do we carry out these skills? By and large, we carry them out whenever we need to. But for the most part, we do it when we get up in the morning. But many people also perform these skills, or at least some of them, prior to going to bed at night, because they know that perhaps a bath or oral hygiene makes them feel more comfortable. We also know that certain skills, such as oral hygiene, are often done at least 3 times a day after meals. And then many times we know that if we're caring for patients or clients, we have to do these whenever the need arises. And perhaps the person has been incontinent. Perhaps the person has had difficulty controlling their urine. We must now help that person to do these skills, particularly perineal care, whenever the need is there. So as to when we do these skills, by and large, I think you'll find we do them at any time that is required for one's health. Now, what about the importance of cleanliness and skin care? If you think about it, and I think we probably don't think a whole lot about it, we need to know that skin is the first line of defense. It is the first line of defense against disease and the invasion of microorganisms that could cause infections or other type of problems. We know that bacteria frequently can enter our body through various body openings, but also through perhaps cuts or scrapes on your skin. We know that intact skin and mucous membrane is essential to bodily health. Consequently, we spend a lot of time doing these skills in order to protect the skin to keep it healthy. That in turn, of course, keeps our body healthy. I want you to think for just a minute about what is meant by the line of defense. Now, this is a protection. It's like a barrier that's out there. Well, I don't want to say it's an army or soldiers. We're not talking that type of defense. But we're talking about the importance of skin as a barrier, as the line, so to speak, between safety and being harmed by those microbes. So skin is essential, and we will spend a great deal of time protecting it and trying to keep it in its best possible shape. Good personal hygiene really prevents a lot of problems in addition to infection. We often think, of course, about body odors and being socially unacceptable when this occurs. We know, too, that for many, personal hygiene skills is a way to relax. It's a way to also feel good about oneself psychologically as well as physically. We also know, too, that many times there's a certain custom, there's a certain way of wearing our hair or the type of clothes that we wear. and that might depend on our age or where we live. Each one of us has a unique way of expressing ourselves through how we dress, how we take care of ourselves, how we wear our hair. And I think this is important for you as a nursing assistant to realize that personal hygiene practices also reflect something about the person whom you are caring. Now remember, what we may think is in style or looks good or looks fine may not be what someone else thinks is in style or looks good. So remember, as we take care of elderly clients especially, we want to consider what is appropriate for that person. We know that as we look at one's grooming, one's sense of self, how they dress, we know that this does affect as well as reflect one's sense of dignity, their individuality. And I'd like you to remember that if you would. When I talk also about these personal hygiene skills, I think we need to consider also that this is one form of an activity of daily living. Think for a minute about the activity that our joints and muscles and our limbs go through simply to dress ourselves, to put on slacks or shirt, to put on, say, some type of a coat or even mittens, something on your hands. That's a way of exercising our limbs and our body. We also know that activities of daily living involve the ability to sometimes do some very fine muscle coordination, such as using our fingers to hold onto a comb, button our buttons perhaps, zip zippers. So realize in fact that sometimes it's not just the whole arm or leg that we're exercising, but sometimes some very fine muscle activity. And what I'm trying to say is that as the individual participates in their own activity of daily living, and here we're talking about perhaps dressing, washing themselves, combing their own hair, perhaps for the man shaving his own face, they are also helping to keep their own muscles and limbs in good working order. We know too that this activity of daily living, such as taking care of oneself physically, also is a way to let that person make personal decisions about themselves. If they can choose what clothes they want to wear on any given day, this is ideal. Perhaps they want to have some decision making as to when they take their bath. And many times I grant you that we can't let them have a lot of extra time, but sometimes once in a while that person wants to make a change in their bath schedule. That should be permissible. We also know that for many people there are assistive devices that they will use to help dress themselves. Sometimes we do use Velcro closures on their clothing because that is easier than trying to, perhaps for the arthritic, button those buttons with sore fingers. We know too that there are many types of devices to help the individual dress. And as we look at the next segment of tapes in this program, I think you will see as we talk about each of these individual skills, you will hear me say frequently the importance of letting that person make their own decisions, letting them do as much for themselves as possible is really a vital part of their health. Sometimes it does take us longer as we stand by to let them do it. But keep in mind it's their muscles that we're trying to build up or at least to maintain as best a condition as possible. So keep in mind that this is a chance for a person to get involved in the activities of daily living. And these are superb chances for them to exercise their joints and to keep themselves in perhaps a little bit of exercise. I would like to concentrate in the rest of this session on the importance of bathing. And in this session, I would like really to just look at some important points about bathing in general, because what I'm going to talk about will be important to whatever type of bath that patient will be taking. When I talk about bathing, I want to talk about some of the purposes first. And let's take a look at the overhead then and see what are some important things to remember when we talk about bathing a patient. First of all, you see that we have quite a few reasons. And one of the most important reasons, of course, is to cleanse the skin. We know that we have sometimes perspiration, sometimes even dirt. Some patients, perhaps urine and stool or feces, which has to be washed from the skin in order to protect it. We've learned that if this is not washed off the skin, very likely we will have sore skin, we will have uncomfortable skin, and very likely even breakdown of skin. We know too that cleansing the skin like that is one way to eliminate odors. And I think you will have to use your sense of smell to tell exactly perhaps which part of the body that odor is coming from. But I think you realize that nothing is going to beat soap and water to cleanse the skin, to make sure that it indeed stays healthy, and to remove these pieces of either dirt or liquids that can cause harm. Let's go back then and take a look at some other reasons for bathing the patient. We know that stimulating circulation by the friction of, say, washing using a washcloth over one's hand or arm, very important. We know that also we can stimulate circulation because of the warmth that that water, either tub bath or shower or the bed bath even, brings to the body. And then we also know that as that person exercises, as they move their own limbs and joints around, they're building up some body heat for themselves. So circulation becomes an important part as we try to help that patient with their bathing. We know too that exercise, superb chance for that patient to exercise their limbs, their arms, their legs, their fingers even, certainly to put their joints through some range of motion. We know too that for many, a bath is refreshing as well as relaxing. And think about it, if you are really tense and uptight, or perhaps you feel like you're aching all over, many times that warm bath is just enough to relax those muscles, allowing you to not just feel refreshed, but to physically feel better as well. Also think about the fact that for many, the bath is a chance to either cool down. If it's really hot in the summertime, a cool bath might help any of us feel better for sure, but also to cool down, as well as to warm up if we're really cold. And think about it if you've ever come in from perhaps being outside and it was very cold out there. If you took a warm shower or a warm bath, you warmed up very quickly. While we're talking about cooling down, I might point out that there might be an occasion where your nurse would ask you to help the patient with a sponge bath. And this might be a chance where you're asked to bathe the patient in a particular way purposely to cool them down when they have a fever or a temperature. If that is the case, I would ask that you check your procedure book and check with that nurse to make sure that you do this one properly. We know too that a bath is the perfect time to observe that client. Now I realize that when somebody has no clothes on, you probably are going to have a lot of opportunity not just to observe their skin that is on their arms or chest or back, but you're also going to have a chance to observe for some other things as well as the skin. You're going to be able to check the temperature of their skin, perhaps on their upper leg or on their abdomen or their back. You're going to see the texture of skin in just about every part of the body. You're going to be able to notice whether there's drainage or bleeding coming from parts that many times are covered up, such as the perineal area. We also know that this is a good time to notice whether there are any bruises or open areas. And open areas we talk about as being, well, we've talked about this over bony prominences of the body. And then also, this is a fine time for the patient who might be expressing such things as discomfort or pain. And think about it for just a minute. If you're helping that patient to bathe or turn or move, perhaps you're going to hear that person groan, or you're going to see them favor a certain part of their body as you try to wash that area. That becomes a very important piece of information. When we notice about observation, I think we also have to point out that there are certain parts of the body that you do have to pay a special attention to, especially if that person is on bed rest. And remember, when we talked about observing the patient to prevent bed sores, we do talk about the bony prominences such as the heel or the tailbone, the shoulder blades, or perhaps the elbow. But I'm going to ask you also to pay a special attention to the toenails, in between the toes. Look on the bottom of the feet to see what that condition is like. It is during the bath that you will get to see these body parts that you normally do not see very clearly. So use the bath as a chance to observe your patients. Very important part of giving that good care. Now, as we talk about bathing, I think we need also to talk about various types of baths. And let's take a look as I list these on the overhead. And I think you will see that there are three main types of baths. The first type is the bed bath, and we have two types of bed baths. We can give a person a complete bath where everything is washed from head to toe, or we can help that person with what's called a partial bath. Now, for just a minute, let's take a look at what's meant by a partial bath. The partial bath is usually given wherever skin surfaces touch. Now, that might be between the thighs. If a lady has large breasts, it might be under the breasts as they hang against the chest area. It also would be in the underarm area, especially if the person is larger, perhaps, and those skin surfaces are constantly in touch. We also know that partial baths are very importantly performed in those areas that are very likely to develop odors. We think of in the armpits or the underarm, the perineal area, sometimes the feet if the person wears shoes that are likely to have odors. We also know that there are certain areas that easily get dirty, and these are the areas that you want to pay a special attention to. And very quickly I've listed these areas, and just to point out to you very clearly, the areas that we usually give a partial bath to involve the perineal area, or the part between the legs, the underarms. We certainly want to wash the hands and face, if nothing else, because those are the areas that easily get dirty. I mentioned also, of course, especially for the lady who has large breasts, to wash underneath the breasts, as well as, of course, for many patients, because they are on their back all the time, we want to make sure that that back is washed and lubricated and massaged as often as needed. We know that the back takes a large brunt of the pressure when it comes to being in bed. Other types of baths then, in addition to the types of bed baths, we would talk about a tub bath, and we also might talk about a shower. Now, when it comes to these types of baths, I think you need to realize that there are some different types of tubs or showers than maybe you have seen in your own home. You will be helped, quite frankly, to use these various types of tubs. Some have lift chairs. Some are the type that the patient can actually get into from a stretcher. But I think you'll find that those you will have to have some assistance with in the facility. And there are many, many kinds of these tubs out there. However, some things that might be added to the shower or tub area, or perhaps different types of chairs that we might use in the shower area. And I think I can best show you these by taking a look at the Sears catalog. Now, I have the current Sears catalog, and you can see here that it's a very well done catalog, and again, I'm not promoting the Sears products necessarily, but it is an excellent example of the types of things that you might see in a tub or bathroom area. And I point this out too because these are easily accessible and obtainable. If you notice the different types of grab bars that might be added to a tub area. For the person who has difficulties getting in or getting out of the tub, these can be very helpful. If you notice too, they can be added to the side of the tub. And you will find that many times these are very quickly applied just by adding a few bolts or slipping over the edge of the tub. Now, we also know that there are types of chairs that will fit into the tub itself. And you can see here that this is a type of chair the person could sit on and actually be in that tub, getting fully surrounded by the water, and still have some assistance with position. And you can see the picture here that the Sears catalog uses for this young boy. Now, we also know that, of course, adults use these as well as children. This is a type of hydraulic lift where the person sits in the chair and, by using water pressure, can swing around into the bathtub and actually be lowered into the tub. Basically then, when we talk about tubs and showers, we're talking about using a simple type of tub, and we don't have to have a real fancy hydraulic lift or expensive whirlpool type tub, although you will find those. Remember that bathing is important, and it is important to the elderly to be clean, but think about this. We oftentimes overdo it. Many times we're so involved in getting that daily bath for ourselves that we think all older people should have one also. And the reality is that maybe we just need to wash certain parts that need the washing and not wash those parts such as perhaps the arms or the legs that are not dirty. Remember, for the older person, we have to consider the changes that do occur because of the aging process. And you do have to make adjustments in your care. I'd like to spend some time looking at some general, what should I say, principles or ideas that relate to bathing. And I think you will find that as we look at these, they'll make sense to you, but they will hold true for just about any type of bath you're going to help your patient get. We have the bath for the patient, generally speaking, we always change the linens whenever the patient is getting a bath. We always make sure that that patient has clean clothes. We always make sure that indeed that patient doesn't put on dirty clothes again. We also make sure that we do not lock a bathroom door. This is important for your safety as well as for the patient's. We also want to make sure that we always protect privacy by using bath blankets, closing doors, making sure that indeed that person is not exposed to the public. Watch the use of soap. Make sure that when you do use soap, you use very little, and also make sure that you rinse it well. Because, of course, the bathroom area, there is like to be water on the floor, make sure that you watch where you walk. Make sure that you are aware of slipping or falling. You many times will use waterproof mats in the tub as well as on the floor to help the patient getting out of the tub. And always, I can't stress enough that you watch your water temperature. It should not burn the patient, of course. And I might note here that for many elderly people, the water temperature might feel differently to them than it does to you. If it feels just about right to you, it might feel very cold or even very warm to them. So keep in mind that you have to use your common sense sometimes, but you also, if the patient says that it's very cold, you also want to keep in mind that, well, if you know that it's the proper temperature, and you know that it, what should I say, that it's proper by virtue of the thermometer, and you know that it's not too hot or too cold, try to adjust it within reason for that patient. I mention this because I have seen quite a few elderly patients insist that the water was either too cold or too hot for them. And you have to sometimes convince them that it is okay. Remember, when it comes to water temperature, that that patient may well be not having their fullest sense of feeling hot and cold that you and I would have. So again, use caution, be careful, but also try to talk with that patient to let them know that you're trying to balance between their comfort and what's safe for them. Let's go back and take a look at some more, generally speaking, points that we need to know about bathing a patient. And remember, these hold true for all types of baths as well. We want to make sure that the patient keeps warm. Again, in a bathroom, the person is naked, is wet, and every draft really is going to be felt and it's going to feel cold. Sometimes we actually put perhaps a towel over that person's shoulder just to keep them warm. We also know that we're going to use a lot of lotion and oils. When we use lotions and oils, remember, many times we're using a replacement for what we are trying to, we're not trying, but we're taking off the skin. And your patient may have special lotions or special oils. We also know, too, that sometimes patients can be sensitive to the products that are in some lotions. So, of course, you're going to use this, but you're going to be careful that if the patient has special lotions or types of products for their skin, that you're going to be very careful to use just that product or just that lotion. And you will want to talk with your nurses ahead of time to find out, to make sure that you're using the proper ones. While we're talking about lotions, I would also mention that if you use these in the bathtub, such as alpha-Cari oil or some of the oils that are more slippery, be careful as that person gets up and out of the tub. They're really apt to fall because the tub now is much more slippery than it would have been without it. We also know that you do have to know how to use the equipment. You will see a variety of tubs and types of devices. I showed you just a few of them. You must know how to use them. Always check ahead of time before you get in a situation where you're going to find out you don't know how to get the patient either in the tub or out of the tub, and you sit there with a patient with no clothes on, and then what do you do? Find out ahead of time if you're not familiar with the equipment. Always, of course, report anything unusual. And certainly throughout the program, we're talking about such a variety of unusual things. I would stress again that you use your own body as a source of, what should I say, a baseline. I think most of us find that we're pretty healthy people. Our skin is in pretty good shape as well as the rest of our body. So use yourself as a guide. And if it looks very different from what you have, you might want to at least point this out to the nurse. But I think most of us do know what looks unusual and what isn't. Important that you never leave the client alone, especially if the person is elderly or perhaps weakened. This can be very dangerous. If the person is in the tub, and let's imagine that that person decides they want to get up and get out of the tub, what are you going to do? And this has happened. Well, you're going to find that you have a call bell usually in the bathtub or shower area. You might want to use that. I've also had the experience where the patient says that they feel dizzy or they're going to faint. I'm not going to get that person up and out of that tub if that's the case. I want that person to stay there, because if they should fall, they're not going to fall very far. If they're lying in the tub, I'm going to immediately drain the water and protect the head from going under the water until I can lie the patient back against the back side of the tub. So try to plan ahead for all contingencies. Hopefully, though, you won't take a patient in the tub if they tell you ahead of time that they feel weak or they don't want to take that bath, or if they tell you that they're going to have a problem. Check it out ahead of time. We also have a few other things that are important to point out. If you have a patient with tubes, make sure that you do watch exactly how you wash around those tubes so that you don't dislodge them. We talked about using products that are required for that individual client. And we also talked about the changes you must consider for the elderly skin. The back rub is always going to be an important part of relaxing and stimulating circulation. Remember, this is a good way to help prevent bed sores. And then last but not least, I think it's vital that you understand electrical safety is just paramount, most important for you to consider. When I talk about electrical safety, I'm talking about not using such things as hair dryers or even electric shavers or razors. I'm also talking about making sure that you don't have radios and televisions, that you don't have anything there that will fall in that tub and cause an electrical current to now come in contact with that patient. Remember then that we must consider each individual client as a unique individual, and we all have different ways of carrying out these personal hygiene practices. However, as we look at some of these in more detail, I think you will have some helps and hints as to just how you can go about helping your patient carry out personal hygiene practices. Remember, these are very important, not just for our physical health, but also for our psychological health as well.
Welcome back. Jenny has really done a nice job on these training videos, and using the video format allows the caregivers to replay and review portions of the instruction that they feel that they need to look at one more time. Let's go on to the personal cares, which is personal hygiene. Jenny divides personal hygiene into 3 areas. First, she will cover perineal care or care of the genital anal area, then nail care, and finally oral care.
Perineal care is the care we give to a patient after the bath or any time during the day, morning, noon, afternoon, evening, whatever, when the patient has soiled themselves either with bowel movement or perhaps urine or other drainage. When we do perineal care, we're going to cleanse the area that is between the legs, and that is the area between the inner thigh, the pubic hair, the other thigh, and of course the genital area as well. Now you notice that I have protected the patient using a bath blanket. I have covered both legs, not just for privacy but also for warmth. I'm only exposing the area that I'm going to be washing. I've also pulled the curtains to make sure that I provided privacy within the room as well. The other part of perineal care that's important is to remember to put gloves on. Now, gloves are important to remember whenever you might handle infectious waste. And we know that urine, bowel movement, stool, feces are all potential hazardous waste. Now, it's not just AIDS that we're worried about, of course, here. We're more concerned also about other diseases that you might either pick up yourself or pass to other patients. So gloves are a wise use. We also will find that most nursing homes or hospitals have either paper washcloths to do perineal care with, or many of them use colored washcloths as well. Any color besides white might be used. In addition to the colored washcloths, I need to have something to protect the bed to keep the sheets clean and dry while I'm doing this. And I might use simply a towel put into the area, keeping the bedding dry. Now, in doing perineal care, it's important that I have bath water that is comfortably warm, 100 to 105 degrees usually. And I want to have my washcloth in the form of a mitt, if at all possible, simply so that I have good control. Now, there are certain things that you can use during perineal care. Many people will certainly want to use soap, whether it's liquid or bar soap. Other times you might find such products as peri-wash or uni-wash, liquid substances that might be either sprayed on your washcloth or directly onto the patient, and then you will cleanse using that. But I'm going to use just a bar of soap, and I'm not going to use very much either. I'm going to use just enough to wash the debris from the genital area. Now, in working with, first of all, the male anatomy, it's important that you handle the penis carefully. It is a sensitive organ, and certainly one that can be harmed or hurt if you are rough with the area. Also, make sure that you wash the area aseptically, which is working from the cleanest area toward the dirtier areas. The cleanest area would be the tip of the penis where the urine exits from the urinary bladder. This is an opening into the sterile bladder, and we don't want to have an infection there. So holding the penis carefully with my washcloth, using one corner of the washcloth, I will cleanse in a circular motion at the tip of the penis in one direction, using the other part of my washcloth, doing the other side right up against the urinary meatus. Now, if you are able to, you can also simply turn your washcloth inside out, and moving farther up the penis, do the same thing, taking another side of the washcloth to cleanse in a circular motion. Always, of course, rinse your washcloth so that you can keep a nice clean feel to work with. Many times you will find there might be more than a washcloth can manage. And I think this is important for you to realize. Then you may have to use paper toweling or certainly toilet paper to clean that up. The other motion that you might use when you are cleansing the penis would be the motion where you can use, again, using different parts of your washcloth, cleanse in an area upwards from the tip, using another part of the washcloth, cleanse another area, turning the washcloth, again going from the cleanest area toward the dirtier area, go from the tip to the base of the penis to cleanse. Certainly after you have cleansed the area, you need to make sure that you pat the area dry, making sure again that you're gentle. You proceed then, of course, to wash the rest of the genital area. And you noticed I call this area the genital area. It could be called the privates, could be called the area between the legs. Whatever you call it, make sure that you cleanse it if it needs to be cleansed. Now, I'm not purposely going to cleanse the anal area yet. I will do that shortly. But I will now dry the area, making sure that it's totally dry. And now we'll turn the patient on the side and make sure that we cleanse the anal or rectal area as well. To complete perineal care, we must now cleanse the rectal or anal area, and this is the area within the crack between the gluteal fold or between the buttocks. We will first, again, remember we're going to clean from clean to dirty. So we want to first cleanse the cleaner area here, and we're going to end up cleansing the anal area last. So we first have our washcloth. I'm going to use, for demonstration purposes, some of the liquid soap or devices that might be used to cleanse specifically fecal material and urine. I will cleanse first the outer area of the cheeks, and then I will end up by lifting the cheeks if you need to, cleansing right around the rectal or anal area, making sure that I get all of that material out. Turning your washcloth if you need to get thoroughly in there if you have more material than your washcloth can manage. Again, if you have excess BM or stool in the area, you should be using toilet paper. And finally, making sure that I rinse the area thoroughly. Always making sure that after I've rinsed, I dry the area. And then lastly, dry the area between the crack or the gluteal fold. Perineal care for the female obviously is going to be different because of the difference in anatomy. And just for the sake of demonstrating something different, I'm also going to do this perineal care while the patient is on the bedpan. And I already have the bedpan in place under the patient, and I have a plastic bed protector in place as well. This type of perineal care is very useful for the patient who needs to have more than just a washcloth, perhaps and some light soap. I first will soap the area well, and this is a technique that you might want to use if you have quite a bit of soap. So first, soaping the area well. The technique I'm going to use is to use one part of my washcloth down one labia, and I will use the other side of the washcloth down the other side of the labia. Again, I use one part of the washcloth only one time. I'm always going to clean from clean to dirty, which is cleaning from the top toward the lower end, which is toward the rectal or anal area. So cleansing in one motion, using one corner of the washcloth down, using the other corner, using the other labia. Now I will rinse my washcloth. With my fingers, I will separate the labia, and toward the inner lips or inner labia, same technique. One part of the washcloth down one side of the labia, switching to the other part of a washcloth down the other side, getting as much of that debris, and of course handling carefully as much as possible. Of course, I would continue to soap the area and get that area cleansed. Now, another technique that you might want to try too is, in order to thoroughly rinse the patient, is to take either a styrofoam cup such as this and just pour the water from top to bottom, and it will of course go right into the bedpan. I can separate the lips as well to get that water in there to make sure that that is thoroughly rinsed. Another technique that you might want to use is to use a perineal bottle, and you might want to have either one of the commercially made perineal bottles. It's full of water, or what you can use, especially in home care or nursing homes as well, perhaps just a plain kitchen dish soap bottle. This has a squirt top and can be used to simply squirt to aim water at a certain area. This, by the way, works very well if the person is on the toilet and you need to get the area cleansed while they're still sitting on the toilet or commode. Perineal care then for the female would then continue by turning your patient and continuing to do the anal and rectal area in the buttocks or the gluteal fold area as we did for the male patient. Another skill that the personal care or hygiene of a patient often requires your attention for is that of nail care. And when I talk about nail care, I want to talk about both the fingernail and the toenails. Now, nail care is something, again, many of us take for granted because we take care of our own nails as the need arises. But I want you to think about doing this with patients in a little different manner, because there are times and places that you must not do this. We know that most of the patients will need to have their nails clipped, their toenails as well as their fingernails. And we do know that there are some patients that, because of perhaps they have diabetes or poor circulation in their lower extremities, there's a certain risk or hazard to your doing this. And it's wise for these people to have perhaps the RN or even the foot doctor take care of that. So realize that as a nursing assistant, there are places and times that you may not be able to cut nails. You want to check this with your facility policy. When we talk, though, about care of the nails, we're really talking about a safety factor here. We know that ingrown toenails can cause that person to have an infection, perhaps, and ultimately even lose their foot. We know that long nails or broken nails can scratch skin, and of course that would be a hazard to that person's safety as well. When it comes to foot care, in addition to toenails being kept clean and cut, we also know that microorganisms can harbor underneath these toenails and in between the toes, and it's important for you to keep that area clean and dry. And then we also know that many times nails can become very dry, very brittle, and very thick, and very difficult to manage or to cut. So let's take a minute then and talk about the types of things you might do when you're going to help your patient with nail cutting. And of course, this includes nail cleaning as well. When we talk about nail cutting or clipping or cleaning, we have to talk about the various devices that you might use. And I think real quickly, I just have you look at all of these that I have on the overhead, just to identify them primarily. Here we have what is called an emery board. It's a file, and if you were to pick that up, that's like a nail file would be. It has a very rough surface, and of course you could use that to file your nail. That would be very wise to use that instead of a clippers, perhaps, to cut the foot of the, or the toes of the diabetic. We have also here what is called an orange wood stick. It's a wooden stick that has a pointed end, which is used for cleaning under the nail, and a flattened end or edge, which is used for pushing back the cuticle. We also have here a clipper, and this type of a clipper would more likely be used for the toe. And you notice that there is a clamp back here that locks and holds those together so that these edges stay together nice and sharp and protected. You have to release that in order to use these. Now these might be used on the person's toes, and they're certainly going to be used if the nails are thicker, tougher to cut. We also have another type of nail clipper, which you have to sometimes adjust, such as I'm doing here. And this, of course, has, many times it also has a nail file on the end. But this type of clipper would be used to cut both toenails and fingernails, and you will notice that both of these have an edge that is almost straight across. There is no way that you can really dig in with one of these devices because of the type of edge. Now, I want to make sure that you realize you should not use scissors for cutting nails. There are instruments out there for cutting nails, and of course for keeping them in a good shape as well as safe. Now, as we continue looking at personal care skills, I'd like you to think about the skill of oral hygiene, because oftentimes we find that as nurses and as nursing assistants, this particular part of, what should I say, one's care becomes a little less psychologically comfortable to do. It's perhaps easy for all of us to do mouth care for ourselves. We brush our teeth and that's just it. We use mouthwash or we floss, use dental floss. But when it comes to doing mouth care on someone else, I think for most of us it becomes something we'd rather not do. Consequently, what I find, at least in my experience, is that many times nursing assistants, because they're not comfortable doing this, neglect that part. And I think you have to realize that you are expected to do oral hygiene. Now, what is the purpose of oral hygiene? When we talk about doing mouth care or oral hygiene on somebody, we talk about the importance of this not just to keep the teeth clean, but also we want to think about helping that person to maintain healthy structures in the mouth. When we don't have our natural teeth, we of course have to probably end up with something like dentures or false teeth. Now, that's really good, because if you think about it, that person is still able to chew and to use the types of foods that they've been used to with their natural teeth. The dentures also help that person to maintain the shape of their face and the contour of their chin and their mouth. We know, too, that those dentures are very important for that person when it comes to speech. When you try to understand a person whose dentures are not in, it's very difficult many times to hear exactly what they're saying. So as we look at oral hygiene then, let's take a look at how we might brush this person's dentures. And I would point out to you that I'm going to go right away to oral hygiene on dentures, and we'll talk about some of the common points after we look at this demonstration in the nursing lab. One of the things that you must pay very close attention to is how to care for one's dentures. Many times we take caring for teeth for granted because most of us that have our own teeth just simply do it as a matter of daily hygiene. But if somebody is unable to get themselves to the bathroom or to help cleanse their own dentures, you are, as a nursing assistant, expected to do that for them. Let's take a look at some very important points when it comes to cleansing dentures. You notice that I have brought my equipment to the sink area in the bathroom. And remember, you've learned as part of medical asepsis that the sink area is considered a dirty area. Consequently, these teeth, the false teeth or dentures that have been in that person's mouth, must not come in contact with the inside of this sink. Another point to remember is you always want to carry the dentures in the denture cup itself or in the emesis basin. Now, if you don't have either one of those, you can always use a clean washcloth. The point is you do not want to carry these just in your bare hands to the sink. They're easy to drop, and of course it's not very pleasant perhaps to have to carry these in the open. You notice that I also have gloves on, and you know that the recommendations are that when you are handling teeth or anything that might have saliva, you want to wear gloves. And remember, this is for your protection as well as, of course, for whatever you might have on your hands that would in turn get on the patient's teeth. And before we start to wash, I would like you to remember that this is indeed a device that is in the patient's mouth. So you want to handle it with all due respect. Make sure that you do not chip the teeth. For most people, this is plastic, and it is fairly sturdy material, but it is breakable. So make sure that you handle these devices very carefully. Another thing you want to do is to constantly check these every time that you clean them to make sure that there are no loose parts. You also, of course, when you took these from the patient, you did take a moment to look in that patient's mouth, look for any sore areas or reddened areas if you notice that. Ask the patient every once in a while, what does their mouth or their gum tissue feel like? Does it feel normal, or do they have sore spots or tender spots? We know that many times when older people have dentures, they do lose weight after the initial fitting, and consequently these dentures may change in how they fit in the mouth as well. Well, let's get on with cleansing the dentures, because indeed that's what we came to do. In order to do our denture care, I'm going to use the emesis basin and just put the emesis basin under the slowly running water, and I'm going to hold that denture in my hand. I'm going to use a little bit of the denture paste, and I'm going to use the denture toothbrush. And you'll notice the denture toothbrush is slightly different than the toothbrush you might use at home on natural teeth. It has two different sets of bristles. I'm going to put some toothpaste, of course, on the bristles, and using the same type of toothbrush motions that I would use for natural teeth, I'm going to cleanse the dentures. I'm going to cleanse in the direction that the teeth are placed, in other words, from the gum line toward the edge of the tooth. I'm going to cleanse the inner surface of the teeth. I'm going to, of course, again look for any chips or loose spots that I might find. I'm going to make sure that I cleanse the entire surface of the inner part of the denture, as well as I'm going to use the pointed end of the brush to clean in the grooves so that I'm able to get at all portions of this denture and get it thoroughly clean. Again, it's important that you hold on to that denture carefully so you don't drop it. But should you drop it, there should be the water bath in the sink, the towel, or the water in the emesis basin. You notice with my running water that is tepid temperature and not cold and not warm, I'm going to rinse the toothpaste from the denture. And when I'm all finished, I'm going to place that denture in a clean denture cup, and I'm going to bring it back to the patient's bedside. Now, you notice that I have placed tepid or cool water, not cold, but cool water in the denture cup. This is because that denture, when it goes back in the patient's mouth, wants to be wet or moist. Otherwise, it will be dry and very difficult for that patient to get that back in their mouth. Now, one thing that you might want to remember as you go back and prepare to put this in the patient's mouth, you will notice in your skills checklist that when you insert the dentures, you're asked to insert the upper denture first. Think about that for a minute. One of the reasons that we would want to put the upper denture in first, can anybody think of some reason why that would be important? Well, I hear a lot of mumbling out there, but the reason that that's important is because before you put the lower denture in, or the denture that will be on the lower part of the jaw, you have a lot more stretch to the lips. And this stretch is important because you notice that the upper denture is much larger than the lower denture is. Now remember, this is an important little trick when it comes to helping that person get their teeth back in their mouth. However, what I have found is most people, if you simply hand them their dentures, they will put them back in their mouth in the way that they traditionally have always put their own teeth in their mouth. One of the things, though, that I think you need to know as a nursing assistant is that these devices are expensive. They do cost quite a bit of money. They do require continual observation in order to make sure that they are in good shape, good condition, not irritating that person's gum tissue. With that, then, we'll continue talking about oral care and look at some other important information that you must know as a nursing assistant. When we look at oral hygiene again, and I would like you to take a look at, basically, as we did the denture care, it gives you an idea what I'm going to talk about. I want you to think about some common things that we want to do whether the person has dentures or has their own natural teeth. One of the things is to take a look at the purposes of mouth care. And I think as you look at this, you can see that we want to keep healthy mucous membrane. Whether that person has their natural teeth or dentures, you must look at the mucous membrane. You must look at their gum tissue to see if it's swollen or if there's any sores or open areas or if there's redness. The purpose of oral hygiene, whether you have dentures or natural teeth, is to remove the food and the debris from the tooth structure. We also want to make sure that the gums are stimulated and kept healthy. We need, of course, to refresh the breath periodically, as well as I said earlier, to inspect the oral area. When I talk about inspecting the oral area, whether those teeth are in your mouth or if they're a set of dentures such as I have here, I want you to make sure that you actually look to see that those teeth are intact. We find sometimes with people who have not had good oral hygiene or prophylaxis or care from the dentist perhaps, they maybe haven't been able to get to the dentist for a long time, or they may have come into the facility with no recent dental visit. So it's not the fault of the dentist. But we need to look at the fact that sometimes that person's teeth are missing or loose. And I find that even sometimes on the dentures, you do have to look to see if there's cracks on these teeth. Are there dentures or pieces of the plastic or denture material coming out or coming apart? Just as you do if the person has their natural teeth in their mouth. So make sure that when you do oral hygiene, whether they have dentures or their own natural teeth, that you actually do look at the teeth. Sometimes you will even find some nursing homes actually count the teeth that that person has in their mouth. When we talk about looking again at the oral cavity, I want to, for just a minute, take a look at some of the things that you need to look at. Remember, we look at the gum tissue as well as the lining of the mouth. We know that saliva as well as the salivary glands are an important structure as well as liquid in the mouth. If the person has a very dry mouth, it may be that you do have to help lubricate the lips as well as the tongue. And what are some things that you might want to use to help lubricate the lips as well as the tongue? I'm going to show you some products that you might want to use, and I think you'll recognize most of these because they're used commonly. And these are just samples of products, and I'd like to talk just a little bit about each one. One of the ones that you might find is petroleum jelly. And the petroleum jelly is a waxy or a greasy feeling substance that basically, is going to not dissolve in water. I caution you, though, if you use petroleum jelly, that you not use too much of it. Use a thin coating and not a thick amount on the tongue or the lips. And usually you want to keep that off of the tongue if you possibly can. It's very easy for body temperature to make that a little bit more liquid and have it actually slide down into that person's lung. And that can cause a great deal of problem for that patient. So if you do use Vaseline or petroleum jelly, and I know I see quite a few older people using it, use a very small amount and use it only on the lips. There are other products, though, that are made purposely to lubricate the lips, one of which is this product called Carmex, and it is a Vaseline-based product used for cold sores or chapped lips. And then also you might find something such as a chapstick, which is, again, these are only given to each individual patient, and only that patient uses it. No one else would use it. And you would find that these products are oftentimes kept right with the other oral hygiene devices that that patient uses. Now, the other device I'd like to talk about is what's called a lemon and glycerin swab. And I will just open that here. And you will notice that I opened it on the end where there are 3 handles, so I can just simply pull one of these out. This is like a great big swab, but on the end is a liquid of lemon and glycerin. Now, a couple things I'd like to talk about with these lemon and glycerin swabs. They're frequently at the bedside. Some places use them and some don't. However, there are some precautions you need to use. First of all, these are not for washing out the mouth. If you need to wash out the mouth, we use what is called a toothette. Let's take a closer look so you can see the difference between these 2 items. You notice that the toothette is more pink and spongy, and you can see that it is also dry. This has to be soaked in some type of liquid, but it's very soft. That is made to soak in some type of mouthwash or liquid that will cleanse the mouth. The lemon and glycerin swab, on the other hand, is used only to lubricate the lips. The lemon, however, and the glycerin together tend to be very drying to the mouth. Consequently, these are not used for great lengthy periods of time. And you want to be very careful, again, that you first wash out the mouth before using that lemon glycerin swab. I think you will find, though, that as you practice cleansing dentures in the lab, and as you are helped to do this by your instructor in the clinical area, that you will become more comfortable as you carry out this personal skill of helping somebody with oral hygiene.
Welcome back. As I said before, Ginny is covering a lot of important information on these videos, and I hope that you're following along in your workbook and taking notes. Let's go on to the next personal care, which is grooming. Ginny divides grooming into 3 areas, and she will start out with shaving, followed by hair care. After Ginny is finished with shaving and hair care, Jan and I will be discussing the 3rd area of grooming, which is dressing.
Grooming is one important part of the way we can express our individuality. When we think about grooming needs, we think now about such things as the way we dress, the way we fix our hair, perhaps wearing cosmetics or jewelry, perhaps wearing for a man the aftershave. Perhaps it also would involve for some people shaving, including some women, but primarily that would involve men, wearing deodorants as well as other ways of protecting one's scent. So when we talk about grooming, I think you need to realize that as an assistant, you will have a great impact on helping that person to continue to help groom themselves as they did prior to their coming into your care. In this session, we want to talk about 3 main areas, though, of grooming, and that involves shaving, the area of hair care, such as combing and shampoo, and also a very important one that you will do frequently throughout the day, and that is dressing, or helping somebody to put their clothes on and take their clothes off. Let's first then talk about shaving. When we talk about shaving, we're talking about several different methods of shaving, and I'm going to talk primarily about shaving the male face. Occasionally, you will want to shave the lady's face. If she has been shaving facial hair for some time, very likely this will have to be continued. Some places have very strict policies on shaving the female patient if that female patient has not been shaved facially in the past. Let's take a moment then to look at the important points about shaving. And I realize that in this session, we're going to just talk about what's important. I'm going to have to depend on your getting the hands-on experience with shaving in the clinical area. And there, of course, your instructor will help you. When we talk about shaving, you need to realize that for most men, shaving or grooming their beard or mustache or sideburns are as an important part of daily hygiene as for the women perhaps putting on cosmetics and combing their hair, perhaps curling their hair as well. The main purpose of shaving is to remove hair, and primarily from the face. We know that beard and sideburns and mustaches are very unique identifying features for the man who chooses to wear them. You need to realize that when it comes to shaving, you do not take it upon yourself to shave off any one of these characteristics. If for some reason the beard or mustache or sideburns do have to be shaved, as with any hair on the head, such as one's hair or curls, no matter how long, you do have to get written permission from the patient in order to do that. And your nurses will probably help you with that if that's necessary. We need to look, as we discuss shaving briefly here, at two methods of shaving. So let's take a look at the overhead and have a look at, first of all, the electric method, or what you might call, some people have called, dry method of shaving. Here I'm talking about using an electric shaver. The electric shaver is much less likely to cut the individual skin, but you need to know that because it is electric, and although I have this one right now not hooked up to a cord, many of these will have a cord that you will attach to it as it's being used. We know that this electric shaver will not be used if the individual has oxygen running. We know that electrical appliances occasionally may spark. If there is additional oxygen in the area, that is very likely to start a fire. For the man, the skin is usually dry by the time this shaver is actually placed on the skin. Although some pre-shave may be used, normally the skin is dry. And then another important role that you have to take care of here is cleaning the razor. And I'm going to attempt to take this razor apart and have you take a look at some things you might do. Now, this is an older razor, granted, but many of your patients will have an older razor. And this is only one type of razor for sure. So as we look at this, you'll notice that there should be a cover on this in order to protect the part of the razor screen that could be damaged if it were just laid in the drawer and able to be punctured or poked. Most shavers come apart, and I'm not just showing you on this particular model, but I think you need to realize that there are parts of the shaver that do move, and you will have to figure that out basically if it's whatever type you're using. You notice that this screen will come out. It can be replaced if it does get damaged, but you should be careful that that is not damaged as you handle the shaver. And then in addition, you notice that we have a shaving portion here with a blade-like device. One of the things, when you look at this particular razor, you will see the blade part here that is flexible and moves, but after the man has been shaved, you will have to take a brush and clean out the spaces between there, because you will notice that there are pieces of the beard in there. Now, if you don't have a brush that goes with the razor, you can use a soft, bristled toothbrush to clean out and get in those areas. Now, a couple words of caution as you clean that device out. You don't want to do this in an area where there's food or dishes. You want to do this over the wastebasket, and very likely you will find yourself doing that in the utility room or the patient's bathroom. So what you have just seen then is the electric razor. With this electric razor, you'll notice that you have various parts, and you want to make sure that if this is not functioning properly or if the razor looks dull, that can be either replaced or repaired by and large. Making sure that when you're finished with the razor and after it's been cleaned, put the plastic cover on top to protect that screen again. In addition to the electric razor, many of you will be asked to use a safety razor. This is not electric. It is many times disposable or simply one that you hold in your hand, and you will find has a fairly sharp blade at the top, and you can cut yourself as well as, of course, the patient with this. So you need to handle it carefully for your benefit as well as the patient's. Let's take a look at these safety razors and some points about them that you will need to remember. You are more likely to cut the patient when you are using one of these. You will notice, for instance, in this one, that the razor blade itself, even though it's in a protective coating, is very close to the edge. You want to make sure that you watch your fingers with these as well as, of course, the patient's facial skin. This type of razor is not used when the patient is on what are called blood thinners or anticoagulants. We know that you are more apt to nick somebody with one of these, and should that happen, it will take a lot longer for that person's blood to clot and stop bleeding. If for some reason the person is nicked with that and there is some bleeding, whether they're on blood thinners or not, you might find that something called a styptic pencil could be used. Now this, when it's moistened on the tip, would then be dabbed or touched to the area that would be bleeding, and that would help to stop the bleeding. If you don't have the styptic pencil, then what you would do is to simply, with an alcohol pad, apply pressure to the area that would be bleeding. And you would simply hold that in place for perhaps a minute until the bleeding stopped. When you use the safety razor, you also consider the fact that some of these are disposable, and of course many of these are not disposable and would have to simply dispose of and replace the blade. For this type, you would simply unscrew the bottom and put a new blade in the top, close it up. Now you have to be careful where you dispose of the razor blade, as well as where you dispose of the entire razor if it's a disposable one such as these. The disposable razor or the blade goes into your devices that hold sharps for infection control. You need to remember that you are very likely going to come in contact with blood here, especially if you nick the person. You must now be careful that when you dispose of these, they are disposed in the proper containers. Again, you want to make very sure that you do not cut yourself when you are handling these. We also know that for this type of shaving, the man often has to prepare the facial skin and beard ahead of time. And many men do this by preparing the skin with hot soap and water. We want to make sure that the beard is well lathered and set up, and many men will use what is called a foam preparation to put on their face, which will help that beard be shaved off. As you practice this, I think this will make a little more sense to you perhaps, but you need to be aware that you want to shave in the direction that this hair is growing. And that is especially true when you're using these safety razors. That will help to prevent ingrown hair, and that can be a very uncomfortable problem for the man for sure. We know, as I said earlier, that you're potentially handling an area where there might be blood contamination. And for that reason, you will find that many nursing homes or care units are not using the unit or common shaver for everybody. Many places are now requiring that each man have his own even electric shaver so that this is not shared among other patients. However, if you work where they still do share that razor with everybody, the electric shaver is what I'm talking about here, then you need to realize you may, in addition to cleaning the whiskers out of here, have to also sanitize the head of that shaver so that we don't carry microbes from one patient to the next. When we talk about hair care, we also need to consider such things as how we care for the hair on our head, you know, the hair that grows up on top of our body. We know that the hair on our head is open to the air, to the currents, and is going to be a very good mechanism for catching germs that are in the air as well as dust. Certainly if somebody's coughing in your direction, your hair is going to receive a good portion of those germs. So we know that hair care, in addition to how it makes us look, is going to be an important part of your keeping that patient free from infections or catching perhaps some microbe or bacteria that could transfer to other parts of the body. Consequently, we pay a good deal of attention to clean hair in the facility or taking care of our patients. One of the main purposes of doing hair care, such as combing and grooming, is because it does refresh the person both physically as well as emotionally. We know that good brushing and combing stimulates circulation in the scalp. We know also that dust and lint are removed from the hair as this brushing occurs. And we know that also brushing tends to keep the hair shiny and attractive. A few words, though, here about the elderly. We know that as we grow older, certain changes do occur in our hair, and this occurs for both the male and the female. The elderly hair does tend to be dry and more brittle, and it also starts to thin out. Consequently, we need to use extra caution as you brush the patient's hair. It certainly won't help if your brushing is going to damage or cause hair to break. We know too that the hair of the older person is likely to gray and lose its color. Some older ladies especially prefer to have their hair tinted or dyed to try to maintain its color. For the older person, because the scalp and the hair does become more dry, we oftentimes do not shampoo that person's hair as often as we would a younger person. And remember, if the hair is dry, the more you wash that hair, the more it's going to get dry as you wash away the oils normally there. When we look at the procedure for shampooing hair, there are some common points that I think we can talk about. First of all, we want to make sure that we choose the proper method for that patient. When I talk about the proper method, I'm talking about, does that person get their hair washed while they're still in bed? Or do they get it washed while they're sitting in the tub taking a tub bath? How about the shower, while they're having a shower? And then there are some times that you maybe take the patient to a special sink designed just for washing hair. And then I think we all know that most facilities have a very important feature in them, and that is a beauty or barber shop, where the patient can go and have professional stylists do their hair. We think this is very important for that patient because it makes them feel certainly like they have really had a very fine job of not just styling many times, but cutting. You and I, as nurses, are not hair stylists, although we are required to make sure that we wash the hair and groom it pleasantly as the patient would wish. You need to realize that your skills stop right there. And you need to know that if the patient needs a permanent or a haircut or more involved hair care, such as dyeing or tinting, you are not going to do that. You're going to have a stylist do that. We know, too, that the method of shampoo is going to vary according to the patient's condition. And I think you need to realize that there are many ways of doing this, and it may vary from time to time with the same patient. Shampoo is usually done at least weekly with the resident's bath. If it's to be done in the beautician or the beauty shop, then of course we would not wash the hair with the patient's bath unless instructed to do so. It's important when we think about some common points of shampooing that you read the label of whatever it is you use. You do not want to use any substance if the bottle does not have a label. Many times, though, patients will bring their own shampoo with them to the facility. Other times, you will use the stock supply. We know that because of the fact that hair does harbor microorganisms, we do have to consider some asepsis here. We know that dandruff is a fungus infection that oftentimes involves the hair and basically involves dry, scaly scalp. Now, there are special shampoos that might be used for that, and of course we need to know that we also, for anybody's hair combing, must wash the brush and comb periodically. When you do prepare the patient's hair, I want you to consider a couple more things about this comfort measure, and this is more psychological comfort than physical comfort. When the person styles their hair, it's usually appropriate to their age. You do not want to have that elderly resident looking like a child. And although sometimes we may braid that person's hair or plait it, some people call it, you need to realize that we do not put clips and bows in that person's hair to make them look childlike. You want to use hair ornaments that are appropriate for their age as well as their situation. If they are going to be lying in bed, of course you do not want to put something that's going to be like a braid or a clip on the back of their head. You would put those off to the side so that that person will not have to lay on the uncomfortable clips or pins. And then, of course, if we use a lot of clips or pins while that patient is in bed, they're apt to come out, and of course the patient would lie on them. That would perhaps cause start of a bed sore. So make sure that you think about what you put in the patient's hair, especially if they're going to be in bed. Let's take a look at what we would do if we're going to shampoo this person's hair in bed. In this demonstration, we want to take a look at what's involved in shampooing someone's hair when they must stay in bed. Before we actually do the demonstration, let me show you some of the equipment that I've gathered and have prepared already. First of all, I've made sure that I've protected my patient with a bath blanket, and this will keep her warm as well as, of course, protected in private. I've already explained to the patient exactly what we're going to do, and I think you can see that we are using a mannequin in lab. One of the things I've also done to prepare for the shampoo is to move my patient to the edge of the bed so that she's a little bit closer. I will not have to reach so far across the bedding that way to reach her head. In order to actually do the shampoo, you realize I'm going to have to bring water to the bedside. I have already prepared a bucket of water. Perhaps you're also going to use a bath basin as well as a bucket. I just happen to have a bucket that is primarily used for washing hair. We carry only clean water in this pail. I also have another pail, same size as the pail that carries the water, and this is marked as the dirty pail. This pail always receives the water that has been used to rinse and wash hair, so that we always keep clean and dirty separate. And in order to help splattering, I have raised this bucket a little bit higher than just putting it on the floor. I am simply resting it on a chair beside the bed. That becomes important because I have raised the bed to my working height. And this, of course, means that there's less for that water to have to drain between the edge of the bed and that pail. I've also collected shampoo, and I'm using a gentle Castile type shampoo, one that will not perhaps burn eyes if it should get into the eyes. It is also going to rinse out of the hair very easily. Now you want to make sure that you do use a product that is intended for shampoo. And of course, some of you know already, you might find there are powdered shampoos or what are called dry shampoos that could be used, but we're going to use wet shampoo and use water. Now, in order to get the water from this pail or bucket, I also have obtained some kind of a cup, and I've just chosen a disposable styrofoam cup, or I need some type of a clean pitcher that I can use to pour water from the pail onto this lady's head. And of course, these are graduates. This would not have been used for anything else except it is designated for hair shampoo. Now, in addition to that, I also, of course, must, when I'm finished, comb and style her hair in a way that is pleasant. I also have a hair dryer so that she will not have to sit with wet hair for very long. And I'm going to lay those aside for the time being because we won't use those right now. I've also brought along several towels, one of which, of course, will be to help dry her hair. But the other one I'm going to give her to hold in her hand just in case we happen to drip perhaps on her face and she does have something to help dry her face. Now, hopefully I'm going to be careful, but you never know. We are using water here, and sometimes it does get on the person's face. We also have something to protect the bed. Now, you realize that we could use a variety of plastic-type devices, and I'm going to ask you to use caution when you use plastic devices. You never want to leave these on the bed, especially if it's a thin plastic, such as you might find over a laundry bag, perhaps over dry cleaning, or sometimes a plastic bag that you might find in a large, what shall we say, 30 or 40 gallon trash size. I have seen those used as bed protectors and they work fine. But again, using caution, be sure that you don't leave them in the area because that could be damaging or detrimental to the patient. However, I have a fairly firm piece of plastic, very much like the thickness or feel of a shower curtain, and that would also work well. This will protect the bed. I'm going to put this under the part where the hair will be, of course, and before I do that, I'm going to put my towel over this. And I think you'll see why, when I finish my procedure, just why I've done that. Before I go any farther, though, I do have to take the pillow out. And now I will just simply put this under the patient's head. And that way you can see that I've protected the bedding, and at the same time you'll see why that towel is important in just a minute. Then I'm going to add what is called a shampoo tray, and you can see that this has a mold for the head or neck to fit into. The water will flow down and out this end. And I'll just put this under the patient's neck area right now. Now, the other part that's important here is to position this so that the water actually drains out of the tray and into the pail that will collect the water. With that, then, I think we're ready to start our demonstration. And because I want to be careful of my reaching, using good body mechanics, I want to bring everything as close to me as I possibly can so that it is within my reach and I do not have to strain or stretch distances. Now here again, the patient has the towel and I have explained what is going on. I've also checked my water temperature, and this is a comfortable, it was about 107 degrees, which should not burn the patient's scalp. So with that then, let's just go ahead and shampoo her hair. You'll notice that as I pour the water, I hold the container so it does not, I don't want to do this. I don't want to drip this right over her face. So I'm holding it so that it is pouring away from her face. And I want to wet the hair well. Now you can hear that sound. And one thing I've discovered when I'm shampooing a patient's hair is that that sound of water many times gives them that very fast urge to use the bedpan. So a little caution I might just suggest to you is that before you do this procedure, offer the bedpan. I'm putting just a little bit of shampoo in the palm of my hand, and as I rub it around my hand to spread it around my fingers, it will better distribute throughout the hair. I don't want to have a big lump of shampoo all in one place. Using the pads of my fingers, not my fingernails, but the tips of my fingers and the paddy parts of my fingers, I'm going to massage her scalp, being sure that I cleanse all parts where I see hair along the side of her face, at the nape of the neck. And I want to make sure, of course, that I get both sides of her hair as well as the top and the back. And of course, at this point, you can be talking with your patient, chatting with her. I'm sure that most patients welcome having their hair washed, especially if they haven't had it washed in quite a while. And then one thing you're going to find is that you do have quite a bit of soap on your hands, as I do here. You do not want to rinse your hands in this water. This is going to be your clean water. So I will rinse my hands in the water that's in the pail. Now I will simply take a clean pitcher of water and start rinsing. And I will use as many pails of water as it takes to get the soap out of her hair. And if I haven't used too much soap, I shouldn't have to use more than one pail of water. Now I have to make sure that I rinse all of the hair, and I rinse from the hairline to the edge, actually where the ends of her hair is, so that I'm sure to get all of the soap. And when I rinse one area, I want to be sure that I turn her head so that I can get the other side. Now this is obviously not as perhaps comfortable for the patient as maybe lying in a chair at the beauty shop, or perhaps the patient might be getting a shampoo while the patient's taking a tub bath or a shower. But this is one way that you can wash that patient's hair and help them when they can't wash it any other way. And it's certainly one of the skills that you as a nursing assistant will frequently do. Now I want to make sure that I rinse the back of her hair so we don't have any areas that I missed. And I notice that my water here is running fairly clear of soap, so I must be getting most of the soap out. Now she doesn't turn her head all by herself, so I have to help her there. There. And I think, how does that feel? Okay, that's good to hear. Now, you notice that I did put the towel underneath the patient in place when I put the protector on the bed. Now this is where that comes in real handy, because all I have to do now is lift up the tray, and you'll notice that I'm going to place the tray right in the pail that did receive the rinse water. Now I have all of my attention to pay for my patient, and the towel is right in place. I can now use that to help dry her hair, making sure that I get the back of her neck, her ear if I was getting the water out of her ear, and I would ask her how dry it feels. Now when I have most of the water out of her hair, I will then use the second towel that she has been using in case I was to get water on her face, and put that towel around her hair and let it soak up the water. Now of course when I'm all finished, I want to fold up my equipment I need to clean the tray, wipe it down, sanitize it with the chemicals your facility require you to use. I would certainly repair the bedding, comb her hair, brush her hair, certainly to give her that appearance that I'm sure she's waiting forward. Certainly most of us appreciate having our hair washed if we can't do it for ourselves. But there's more to just washing hair. We must also make sure that it's combed and that it is pleasantly styled. As we look then at some of the various adaptations that you will want to use when we help our patients with their grooming and dressing, I think you can see that there are many different aspects of this particular skill. As you gain experience helping take care of patients, I think you will find that these become more interesting and more challenging, and you will find that your patients are the best resource as to how they like to be groomed, what they like for clothing. Please give them the chance to have choices in not only what they wear, but how they fix their hair, how they choose their makeup. Let them make choices, and you'll find that they enjoy their grooming a lot more.
Jen and I are going to talk a little about assisting the resident with dementia with dressing. Assisting the resident with dementia with dressing may prove to be a real challenge. It may take a little longer to dress, and he or she may want to dress inappropriately. Dressing in the wrong clothing for the season, a poor choice of colors and patterns, they may put the clothing on backwards, and sometimes he or she may not want to wear any clothing at all. Let's look at some of the reasons why we need to assist the resident with dressing.
Reasons for dressing the resident are to keep the resident clean and comfortable, to increase the resident's self-image and well-being. You know how you feel better when you feel that you look well and you're comfortable in your clothing. And to reduce the resident's discomfort and to reduce the risk of strain or injury.
So we're going to cover some general guidelines for dressing. First, you need to remember that the resident with dementia may not remember how to get dressed, not recognize his or her clothing.
May I interrupt here for a minute, Sally? I had a resident who lived in a nursing home in a residential area with dementia, and I went to visit her one day, and she said to me, you know, I have several rooms here. They're really quite nice. And I said, and that's a nice outfit that you have on. And she said, yes, isn't it lovely? I found it in that room down there. So she didn't recognize her own room, nor did she recognize that she was wearing someone else's clothing.
And this is very common behavior in people with dementia. Thirdly, they're not aware of the time of day or the season or the year. They may not have the balance or the motor skills that are needed to fasten buttons or to close zippers. They may be bothered by the lack of privacy, a cold room, poor lighting, or loud noises. They may feel very pressured to get dressed quickly. They may find the task of getting dressed just too complicated, and they may be embarrassed to get dressed in front of a stranger.
An important factor in helping a resident dress is to provide privacy at all times. Keep the morning routine of dressing as familiar as possible. Encourage and assist the resident in choosing their own clothes. Sally discussed this in a prior piece of this unit. Give simple choices. Avoid a large selection of clothing, which can be confusing for the resident. Avoid busy patterns, which can be distracting. Select colors that contrast, they're easier to see, and make sure the clothes are neat and clean and in good repair. Choose clothing that fits comfortably. Have several sets of clothing that are the same for a resident who wants to wear the same thing every day. Make sure the clothing matches and is not put on backwards. And lay clothing out in the order in which they are put on.
Always start by dressing the upper body first. And when you begin to dress the patient, you always want to go to the affected side first, and then go to the unaffected side. If you go to the unaffected side first, the patient won't be able to assist with reaching to put the garment into their affected arms. So you want to always use the affected side first when you're putting a sleeve on, and then go back to the unaffected side. And you also want to encourage your resident to do as much as possible. You want to make sure you're only doing one step at a time. Dressing has many steps and can overwhelm the resident with dementia. You want to allow enough time for the resident to get dressed at a very comfortable pace for them. You want to make sure footwear fits and is comfortable. You want to avoid footwear with high or slippery heels, and you want to encourage them to wear regular shoes instead of slippers for better support and safety purposes. And a nice shoe to wear is a good, well-fitting tennis shoe because it grips the floor, it's comfortable, and it gives them support. You want to show a positive attitude about the resident's appearance and compliment them when it's appropriate.
Dressing can be made easier by selecting items that are easy to put on and easy for the resident to wear. Slip-on shoes that fit, that are secure and comfortable without sliding off. Elastic shoelaces are wonderful. You can wear a regular Oxford and the resident can put them on like they would a slip-on shoe. Sneakers with Velcro closures, pants with elastic waistbands, clothing that closes in the front. Velcro closures are large zipper pulls, tube socks, jogging suits are very easy. That's very helpful for someone with dementia. Cardigans and button-down tops instead of pullovers, clothing with big rather than small buttons, snaps rather than hooks and eyes. It's important that you observe, report, and document the resident's behavior as part of the dressing process. Changes in the resident's physical ability to dress and undress. They might be able to put a shirt on today and not remember what the shirt was tomorrow. Changes in the resident's mental ability to dress and undress, and problems with dressing or undressing that the resident reports or that you observe.
Dressing supplies include undergarments, outer garments, stockings, and shoes.
The procedure of dressing needs to be organized. Explain the procedure to the resident, wash your hands, assist the resident in selecting the clothing, lay out the clothing in the order in which the resident is going to put them on. With the resident seated comfortably on a chair or the bed, begin assisting the resident with the upper body and undergarments, dressing the resident's weak side first. Assist the resident in the same manner with the outer garments.
To put on socks or stockings, turn each sock down to the toe end and assist the resident in smoothing them onto each foot. Pull socks and stockings up completely. Assist the resident with their pants and pull up underwear and pants as high as the thighs. Put on shoes and assist the resident to a standing position. Assist the resident in pulling up the underwear and pants the rest of the way.
The next area is probably the most personal of all the personal care areas, and sometimes an embarrassing topic for many people to talk about, and that is urinary and bowel elimination and toileting. Toileting is a very private and personal part of the resident's day, and Ginny's approach to this subject is very sensitive, yet very direct and informative. I think you will learn a great deal from Ginny's presentation.
The topic is going to focus on elimination needs and particularly urine elimination. Assistants will frequently be helping patients to transfer to the commode or to the toilet or to use the bedpan. You will also be observing for problems that patients may have, signs and symptoms that they're having difficulty. And you also will be responsible to record these, to report them to the proper person. In this class then, as I said, we will focus on urine elimination. But first we need to look at some general principles when toileting somebody. And for this, we'll refer to this for both urine and bowel as well. Independence is promoted whenever somebody can get to the commode or to the toilet. At least the bedpan is third best if that's all that the person has. These are far better than just allowing that person to make a mess, so to speak, in their bed. That is definitely not independence and is definitely not promoting one's dignity. Position for elimination, whether it's bowel or urine, must be for benefit to the patient and effective outcome, upright position. Sitting up straight, sitting either on the toilet, the bedpan, or the commode is going to definitely help the process. Privacy is definitely essential for dignity as well. This is a very private function for both men and women by and large. And many people, in fact, will not be able to go if they have to share, say, a semi-private room with another patient and use the commode right next to that other person's bed. Safety must be considered here. If you're going to have somebody on the toilet and they're unsteady and not able to sit up, you must stay with them. You never tie somebody to the toilet or to the pipes that might be behind the toilet. You always stay there and you support them yourself if necessary. You must make sure that indeed comfort is considered. Now most people just don't perch on the toilet for long periods of time. It can become very uncomfortable. So you do not want to just leave somebody there. The person should not have pain because of the way they're sitting on the toilet or the commode. And yet sometimes we know that people will have pain. Try to prop them with pillows perhaps, or try to support them so they're as comfortable as possible. Cleanliness is another thing that we must consider when we talk about toileting. Skin care, essential that after the person has toileted, they are cleansed with either wipes or the individual disposable wipes, or soap and water and a washcloth and a towel. Dry skin and clean skin is essential to prevent bed sores and irritation. We know that clothes must be kept clean, free from odors. Undergarments must be changed regularly. Sometimes you're changing clothes 2, 3, or more times a day for some people who have difficulty with urine and bowel elimination. Make sure that odors are definitely taken care of with soap and water and not covered over by strong perfumes. When I talk about asepsis, I think you must consider here that toileting usually involves the dirtier parts of our body. We know that you should wear gloves when you handle anything that might contain urine, such as catheter bags or bedpans or commodes. If you're washing the perineal area, make sure that you do wear gloves. Make sure, too, that soil pads and undergarments are disposed of in the proper location or area. Many of the paper diaper products that adults will wear are usually wrapped in plastic and disposed of in the utility room in the trash container. Clothing is usually rinsed out and put in the dirty clothes container. Now we know that as far as asepsis is concerned, you must wash your hands as well as the patient's hands after toileting. This is simply for your safety as well as, of course, the patient's safety. We know that when we talk about the urinary system, we talk about we talk about various structures. When we talk about the structures of the urinary system, we'll take a look at a picture at this point, and I think you can see better what I'm trying to talk about. Especially for the female, you notice that there are 3 openings. The first opening is that of the urinary meatus. This is where the urine comes out of the body. Then there's the vaginal opening. This is the birth canal opening. And then you have the rectum or anus. Now, as you look at these openings, it's extremely important for you to understand that the urinary opening is where sterile urine comes out. The vagina is considered a clean opening, and the anus is considered a dirty area. Consequently, when we talk about asepsis with toileting, you always want to wipe from front to back, particularly on the female patient. You never wipe from the anus or the rectal area and then come forward and wipe or wash the vaginal or the urinary area. For the male patient, that's not so difficult to accomplish, but even for the man, you wash the urinary or the penis first, and then you can wash the rectal area. When we talk about principles that involve toileting, we also talk about making very careful observations of what you see. And I will be talking very particularly about urine in this tape, about what you should be looking for. But keep in mind, anything that is unusual should be reported. How do you know if it's unusual? Well, most times we suggest that you use your own body as a guide. Aren't we all normal? I would imagine so. So use what comes out of your body as a guide for what should be normal. And I think you'll find that's a good place to start. And then another thing to consider when we talk about toileting is that this is a learned control. Children learn this at an early age, how to control those sphincter muscles that are around the edge of the bladder and the end of the urethra that help us to control that urine from escaping. Nerve damage or illness often can cause disruption here, and urine will then, of course, come out all on its own. We know, too, that when we talk about toileting patients, we need to have certain equipment. In these pictures, you'll be able to see that we have what is called a standard toilet. And the toilet that you're looking at has been adapted with grab bars, with bars on the wall to help the person get up or sit down on the toilet. And also you'll see that there are armrests that attach right close to the toilet so the person is easily supported. You might find that a raised toilet is also installed in many facilities. This is so that the person can just automatically sit down easier. Many of the toilets in one's home are lower to the ground, perhaps by 2 to 4 inches. That is difficult, just those few inches, if one is handicapped or disabled. We know, too, that there are also varieties of what are called raised toilet seats. And you can see an example here in this picture where the toilet seat, a plastic molded design, is simply laid on top of the toilet rim, and the person would sit down on that. That raises the toilet by at least 6 inches, making it easier for the person to get up and sit down. And of course, both men and women would use this device. Now, in addition to toilets and raised toilet seats, we also have a device called a commode. This is a portable, lightweight toilet which can be carried to the bedside. This particular model is a very basic model, and it's just a chair with a toilet seat on it and a pail attached underneath. It can be carried to the bedside or any place where the patient will have privacy with its use. It simply allows for a more normal position during defecation or urination. What are some things that you must consider when you use the commode? A commode is very simply a toilet. So you must think of what you would do if you were taking care of a toilet. Well, first of all, it must be kept clean. The pail must be hand emptied, of course, because there's nothing to flush. You will have to, of course, empty that into the hopper sink or into another toilet and flush that. And you will find brushes and different items that you can use to cleanse this out in the utility area. Most times when you return that pail to the commode chair, you will add just a little bit of water to it. That makes it easier when the patient does have the next bowel movement to empty that out. As soon as we talk about urine elimination, I have a feeling a lot of you are thinking that you have to go to the bathroom yourself, right? Because many times we learn that when we think water, we think urination, we think anything liquid, that activates the nerves in our brain to want to empty our own bladder. Well, keep in mind that when we talk about the urinary system, there's a strong connection between these structures and the brain's control. And although I won't talk about that here, I want you to realize these structures are under the control of our nervous system as well. But we do have kidneys which filter the liquid waste from our blood. This also helps to regulate the fluid balance in our bodies. The kidneys are attached to the bladder by 2 ureters. These drain the urine from the kidney down into the urinary bladder. And the urethra exits from the urinary bladder, taking the urine to the outside of the body. I want you to remember that there is a sphincter muscle around the neck of the bladder where the urethra comes out. This is important because this is the muscle that we learn as children to control. By squeezing that, we know that we can keep urine in the bladder. Should the nerves be damaged, perhaps a stroke or trauma or spinal cord injury, those nerves may not work. We also know that sometimes these muscles become weakened with age, and as they do, urine is apt to escape. We know that the urethra is different in both in the man as well as the woman, and a couple differences I think are pretty obvious as you just simply know the difference between a man and a woman. The plumbing is different. However, keep in mind, in the female, the urethra is about 2 to 3 inches long from the outside of the body to that sterile bladder. Now, 2 to 3 inches is not very much, and you might want to find that on a ruler. The very shortness of that female urethra is one reason women have more urinary tract infections than men. Now, that urine should be sterile. There should be no microorganisms in that urine or in that bladder. However, if the female does not wipe properly, working from the cleanest areas to the dirtiest areas, in other words, wiping from front to back, it's very easy to get bacteria from the rectal area into that very short urinary tract. And they, of course, quickly get into the bladder, causing infection. In the male, we know that the urethra is anywhere from 6 to 8 inches long. And for the male, this is not only the tube for the urine, but it's also the tube down which the sperm comes. We also know that at the end of this urethra is what is called the urinary meatus. A meatus is just another word for opening. And this also is a circular sphincter-type muscle, which can be controlled as well. And when this is relaxed, urine exits, whether it's the male or the female urethra. We know that when we talk about normal urine, we have to describe normal urine